Hello, everyone. My name is Teresa Villaran, and I'm the president of the ANA Bluegrass chapter. My project was Intersection of Social Justice and Healthcare. Nurses can lead these discussions. It was a pilot project. I wrote the pilot in 2020. As you know, there were a lot of things going on in 2020, and these pictures represent that. I wanted to collaborate with the Kentucky Nurse Association. In 2020, they wrote a resolution, Equity in Healthcare Outcomes. And I wanted to be part of that plan to enact an action plan to address the issues of inequality and the impact on Kentuckians' health and health outcomes. But I wondered if nurses should actually have these conversations, should actually be in these spaces, and it turns out we actually should. The Code of Ethics for Nurses with Interpretive Statements said we should integrate principles of social justice into nursing and health policy, and our nursing scope and standards of practice says we should integrate principles of social justice in all aspects of nursing practice. So we should have these conversations. So I wrote the proposal. The purpose was to educate nurses and nursing students on the history around social injustice, its infusion into healthcare, and start dialogue and solution building on the change needed to right the inequities within healthcare. This project was to have a movie night. The movie night was actually watching a documentary, and immediately after the documentary, having discussions. It was going to be just myself and a small group. We planned on 15 participants for each session. We were having a session a month from January 2021 through June 2021. The problem was we ended up having more participants than we thought. We knew that this was a great project, but the conversations were going to be difficult and make some people uncomfortable. So we thought we would have 15 participants per event for 6 events. So we projected 90 participants, and we ended up having 522 participants. So it was a success. We had our panel. We decided to have a panel discussion instead of me, since there were so many people. And in that panel discussion, we wanted to make sure that nurses were represented well, that they were leading these discussions, that they were working in these spaces. So the documentaries we watched were anywhere from Power to Heal talked about how Medicare, when it was implemented, was used to integrate healthcare institutions and hospitals. We talked about the mass incarceration problem, climate change, emergency department being used as a safety net. The providers was about rural health and how there's a lack of resources, not only for patients, but for the providers themselves. And also a dangerous idea was about using genetics to perpetuate racism and the belief that certain groups are superior to others. This project was a success. Participants thought it was outstanding, impressive, interesting. One participant actually came up with what we're going to have to look for in the future, and that's how can this content be integrated into academic curricula and practice setting orientation programs. And that can be possible by utilizing it in a senior seminar or using it as movie nights and giving students points for attending, because these conversations do need to be had by nurses. Some recommendations: we do plan on continuing the program quarterly. We've already had our first one for 2022. It was on Black maternal mortality. We are getting ready to have our next one, which is disparities in chronic kidney disease. Our third one will be on racism in nursing, and our fourth one is to be discussed. Some things we learned: to make sure your tech works and plan for when it doesn't. A few people were unable to get into the conversations because they couldn't get into the Zoom discussions. And involve community partners. We did have community partners in one of our movie nights, and they lend a certain perspective to the conversations. So this is a great project for anyone to do. We are planning on doing it in the future, and if anyone would like information on how to do a project like this, you can contact me. I thank the ANNA for allowing me to highlight this project, and thank you for coming to my presentation.